Hi, everybody. My name is Naya Harris, and I'm here with the ODM English Show. And today we have a special presentation for you, Dr. Chomilo. Chomilo? Yes, Dr. Chomilo is here. He is the medical director for the Minnesota Department of Human Services. We are going to talk a little bit more about medical assistance and health insurance renewal, but we want to learn a little bit more about him. Welcome, Dr. Chomilo. How are you?
I'm doing great. How are you? Thanks for having me.
Yeah, I'm doing great as well. It's Friday, right?
Mm-hmm.
Got to be excited about that. Well, I want to learn a little bit more about these talking points. Like I said, medical assistance, medical insurance renewal, but I want to get to know you a little bit too. So we were talking a little bit before the show began here, and you said your most important title is?
Dad.
Dad.
And husband.
And husband. Okay.
Equally
yes. Well,
yes.
Tell me about being a dad. You said 2 boys.
Yeah. I'm a proud dad of a 2-year-old in G and an 8-year-old in Chare.
Okay.
Who it's his last day of 2nd grade already, which is crazy.
Yeah, that's how it goes. That's how it goes. These years go by really fast, right? And then you said husband as well. Tell me a little bit about your wife.
Yeah. So my wife Jenny, who couldn't have the 2 amazing boys I have without her, and do all the things that I'm able to do professionally without her taking care of us at home. But she's also a nurse. She's worked as a school nurse, as a nurse at a cancer clinic, as a nurse at a children's hospital. So
wow,
kind of have that shared love for kids and for health.
Okay, awesome. That is
and each
awesome.
other.
And each other, yes, of course, right? Well, wonderful. Well, welcome again. We're so happy that you're here. Let's get into this a little bit. So, medical assistance, health insurance renewal. We all kind of know like what health insurance is, kind of on a high-level overview, right? That's what you need if you go to the doctor. But let's dial back a little bit and tell our viewers like why is health insurance important?
Yeah, so health insurance, particularly in our country, is really tied to your employment, right? And so it's most people get health insurance from their employer, but we recognize that not everyone does, and so there have been systems and programs set up in place to help folks access health insurance, because we know that folks who have access to health insurance are more likely than to see their doctor or their nurse or their therapist when something comes up.
Sure.
And it helps folks stay healthy and folks get healthy quicker. And we know that healthcare is also expensive, particularly in this country. And so if you have health insurance, it's actually good not only for your physical health, but for your financial health, right? You're much less likely to become bankrupt or lose things that you've worked hard to earn and get, like a house or a car, or even your job itself. And so really having health insurance can really helps open up a lot of doors to keep folks healthy, and to help folks get healthy who have stumbled into some health troubles.
Sure. What about the folks who are, if you have an employer that has insurance, great, that's covered. But if you are underinsured or uninsured, right? What do those folks do, right? The folks who are paycheck to paycheck trying to figure it out, what do they do?
Yeah, so here in Minnesota, you talked about medical assistance, right? You referenced that program. Yeah. That's our name for Medicaid.
Okay.
And so if we kind of back up a little bit, there's a number of different ways and different programs in this country that we have that help offer health insurance. I like to kind of make the distinction at the top between Medicare and Medicaid, right? Okay. So Medicare is a system for health insurance for our elders or those 65 and older.
Okay.
Right? And it's much more streamlined, and the federal government is the one who administers it, so it's kind of the same around the country, and it's based primarily on age. There's other ways that you can access it, but primarily if you're 65 and older, if you're a resident or a citizen of our country, then you have access to Medicare. So Medicaid, which is where I work, that is a state and a federal collaboration. Okay. And so the state puts up $1, the federal government puts up $1, and they put that together to provide health care for folks who qualify. The way folks qualify for Medicaid is based off of your income. And so it was initially designed for folks who, as you were talking about, might be working but don't make enough to afford insurance, either through their employer or through the marketplace, or buying a plan by themselves. And so like the working poor is kind of generally who was initially designed for. And then since then, it's been built upon by our leaders and legislators. It's expanded coverage to cover more children, to cover mothers and birthing persons, to cover folks who are experiencing disabilities as well. And so, right now in Minnesota, Medicaid, that program that we run with the federal government, it covers, roughly, 1 in 4 Minnesotans throughout the state, and even higher numbers if you look at our kids, where it's closer to kind of 1 in 3, 1 in 2 of our children are getting covered through Medicaid. And so it's a real vital key connection to healthcare for so many of our community members.
Okay. I think a good way to remember that: Medicare, Medicaid, right? Care for the elderly, and CAID, or aid for folks who need it, right? Yeah. Kind of like putting a little Band-Aid on it. Okay, so Dr. Chomilo, what is the message that you want people to know? What do you want them to know who are in that boat, the working poor, like you said? Like, that might be the very last thing on their mind, right? What do you want them to know?
That we have systems in place to help. And one thing I think we're really proud of in Minnesota is that we try to do our best to care for each other and for our neighbors. And so one of the ways that shows up is through how we offer health insurance, and not only just having a program that in kind of writing says that you're eligible, but a lot of resources to help you navigate that system, because we all know, right, like our healthcare systems are unfortunately kind of complex. It's here, and so sometimes it's really helpful to have someone who has gone through it before, who speaks the same language that you do, and so you can go to, for starters, for folks who might not know what they're eligible for, there's a website called Mnsure, MNSURE, that you can go and kind of fill out initial information, and that can help direct you to where you might be most eligible to get assistance. They have things called navigators, folks that actually help navigate the process, right, of enrolling for healthcare coverage and figuring out which program is the best for you. And so, really wanting folks to know that, like, there's resources there for you if you don't have health insurance. If there's someone in your family that doesn't have health insurance, whether it be a child, a spouse, an elder, helping them, they can help you help them get connected to healthcare as well.
Welcome back. We are having a conversation with Dr. Chomilo on medical assistance. Dr. Chomilo, thank you so much again for being here. We were talking about, on average, how long the turnaround time is, right? From application start to actually getting that insurance card. What do you think? How long does that process usually take?
That's a great question. One partner I didn't mention, I talked about the federal government and the state government, but in Minnesota, our Medicaid program is administered by our counties, right? And so if you qualify for Medicaid or Minnesota Care or medical assistance, it depends on who actually processes your application. And so the timelines can vary, but there is a possibility if you go through Mnsure, there's certain times where if you are able to have all your information and you submit it, that day you could be signed up for coverage that day. And if you qualify for medical assistance, we have what's called retroactive coverage, where once they determine that you're eligible, they will cover your bills for up to 3 months prior to when you applied, right?
Wow.
So even if you have something that came up, you were in an accident, an unexpected health cost came up, you had to go to the doctor, and you didn't have health insurance, if you go through the process, you could find out that you actually were eligible and get those costs covered up to 3 months before.
That is amazing. That is amazing. I want to ask you about the folks who are still hesitant, though, that it's just going to cost too much. I don't have time. What do you say to those folks? How do you encourage them to, if you can talk to our viewers, how do you encourage them that this is really important, that this is something that they need to do?
Yeah, I think health insurance is there for, just like you have car insurance or homeowners insurance, for the unexpected. Right, and so sometimes things might be going well. You might feel very healthy, very strong, and you slip on a Lego at home and hurt your hip, and then all of a sudden you're dealing with pain and you can't play with your kids the way you wanted to. You can't do the things you need to do at work, and that's going to impact your health and your lifestyle and your family's health and lifestyle and your community's health and lifestyle. And so, health insurance is one tool. It's not the only tool, but it's one tool we have to keep folks healthy. And so you might have children at home who are really healthy right now, and we take them in to see the pediatrician to keep them healthy, right? To get them the immunizations or shots that keep them healthy, get them the checkups, making sure that they're growing well, getting you good guidance on how to keep folks healthy, or to help folks recover from those unexpected events that come up. And again, this is something about our pocketbooks too, right? Like again, these health events can sometimes really drain your resources. All of a sudden you've been saving up for a trip, and all of a sudden you can't go on the trip anymore because you have to pay this doctor's bill because you didn't have health insurance, right? And so thinking about ways that health insurance can really help us meet our goals, keep us healthy, keep us in community, keep us in our families.
Wonderful. Thank you so much for that. I did think of one other question too. There may be, folks might have reservations in terms of doing this process, right? Because they may feel like, oh, their English isn't good, there's a language barrier, they're not going to, understand or identify with me. What do you say to that?
Yeah, and that's where we're really fortunate to have a strong list of organizations who are identified as MNsure navigators, okay, who help folks navigate the process of filling out all the different paperwork. How do you show how much money you are or are not making, right? Mm-hmm. Where do you find those pieces of paper? How do you get them into the application? If there was a field that you missed, like some people were like, I spent all this time filling out this paperwork and I missed one box, and they sent it to me and said, no, they can go back through and help correct that information, resubmit it, help get you through the process. And so again, we really lift up the work of our MNsure navigators because they've done such a great job getting folks connected to coverage, and again, finding which program makes sense for you and your finances and your family is their job. So many of them are trained from our communities, right? They have our lived experiences. They speak the languages that we speak. Mm-hmm. And so it's a really great resource that we want to make sure everyone's aware of that can really take away some of that anxiety of going to a county office and worrying about how we might be treated or not being able to have all the information right away.
Yeah, absolutely, Dr. Chomilo. Well, thank you for that. I appreciate that. I know I said one last question, but I do have one more last question,
Absolutely.
Which is, okay, so is there a open period that health insurance renewal is going on? Is it going on right now? It'll be in a couple months. What can you tell us?
That's a great question. And so it depends on what you qualify for. Mm-hmm. So if you qualify for medical assistance, it's always open. If you meet the eligibility requirements, you can sign up and get coverage started today. Okay. For folks who might qualify through things like the Affordable Care Act, in Minnesota Care, there's different enrollment periods that are usually in the fall. And so it's important to pay attention to those, particularly if you have been covered by them before and you have to resubmit your paperwork. It's important to do those during those specific windows. But that's, again, another one of those things that there might be some thing happen in your life. You change jobs or lost a job, right? Sure. Or you welcome the child to your family, right? Or about to welcome a child, you found out you're pregnant. And so there's certain situations where no matter what time of year it is, you could qualify for coverage. And so they're really helpful at helping understand, when's the best time. But in general, we point folks to, if you've been enrolled in Minnesota Care or through the Affordable Care Act before, to really pay attention to those open enrollment periods in the fall, because that's the most specific time, but it's possible that any time in the year you could be eligible. And so, working with a navigator to figure that out if you don't know yourself.
Okay, so it sounds like you really have to probably check in with a navigator first, explain your situation, and they can identify whether or not you are eligible for coverage now or in the fall, like you said. So that's wonderful. Well, thank you so much for joining me. I really appreciate it. Before we go, I want to make sure if there's anything additional that you wanted to share or make sure that the watchers know.
Yeah. So I think to sum up what we've talked about here today, health insurance really is a critical tool to help keep us healthy, both physically, emotionally, mentally, as well as financially. And so there's a lot of things that we've built here in Minnesota to help with that. You can find out more either for yourself or maybe you work at an organization that you want to help connect other community members to. Go to Renew My Coverage. It's a website set up by DHS to help give folks more tools on how to keep folks connected to coverage or sign them up in the first place. as well as MNsure to go through the process of signing up in the first place. And just also reminding folks that at any point in the year, you could be eligible for medical assistance or Medicaid or Minnesota Care. And so don't let that stop you from looking up and seeing if you are eligible for health care. And then the programs we talked about today, there's a lot of conversation about big potential changes. And so folks do need to be aware that in Washington, D.C., they're talking about making cuts to these programs. And currently, we're able to offer things like coverage to our Minnesotans who are undocumented, right? Currently, we're able to offer care to folks seeking reproductive care for their pregnancies anywhere they want. Right now, Congress is talking about taking away some of those coverages. And so really important to look around and see who in your community is impacted by Medicaid, and then share those stories with your legislators, whether they be your state representatives, your federal representatives. Talk about it in your communities about the importance of Medicaid. And so folks really know what's at stake here, so we can keep our healthcare system in Minnesota strong, keep these investments, these things that we've been able to build together strong, and we can keep our communities strong.
That's amazing. Thanks so much for sharing that information. And if you need more information, we encourage you to go to the website. You'll find a QR code or the website link right on your screen. And I thank you again so much for being my guest today.
Why is having health insurance important? Health insurance helps you pay for visits to the doctor and your medications. You can get help signing up for free or lower cost health insurance. When you keep yourself and your family healthy, you help keep your community healthy. Find out if you're eligible for Minnesota Care today. Visit mn.gov/DHS/Minnesota Care to learn more.
It was my absolute pleasure to interview Dr. Chomilo today. Again, he is the medical director for the Minnesota Department of Human Services. We learned a lot of information. If you have any questions, don't wait, don't hesitate, don't delay. Check out those websites or the QR codes that are on your screen. And it was my absolute delight to be here today, and I look forward to our next time together. Thank you for watching.